Yeah. All right. Well, welcome. Here we are at the Metabolic Health Summit 2022, getting started to kick off day number 2. This is a fantastic conference. If you don't know anything about it and you're joining us for the first time, it's really a wonderful compilation of getting some of the biggest minds, from researchers to clinicians to just advocates and believers about improving metabolism, whether we're doing it through exercise, through ketogenic diets, through other means, all about metabolic health. And it's so invigorating to be part of a live conference once again. And our job and sort of our pleasure here at Diet Doctor is to be able to interview some of these amazing people coming through. And this morning, we're kicking it off with a good one with Dr. Colin Champ. So thank you so much for joining us. And I got to say, looking at all the talks and the titles, yours stood out. I think your title had the coolest title: Harnessing Metabolism in the Gym to Beat Cancer in the Clinic. And I just love sort of the imagery that portrays of what you can do to help not just metabolic health, not just weight loss, improving health, but actually beating cancer. So give us a little bit of overview of where the title came from and kind of what your talk is going to be about.
Sure. So we have all of our cancer patients coming into the gym to do prescribed exercise programs. So we're not just prescribing radiation or chemotherapy. We also want to prescribe diet and exercise. And we're targeting the same pathways in doing that. And also helping these cancer patients to come out moving better, feeling better, and having an overall better quality of life.
Yeah, that's so important. I mean, it's not just about treating the disease, which is obviously very important, but also improving quality of life. And so key that exercise can play a role in both of those. Now, where do you stand, or where does the evidence stand in terms of exercise improving cancer? Because I would think it's something that probably hasn't been studied a whole lot, but really should be.
Yeah, it's typical when it comes to diet and exercise. A lot of population studies, a lot of studies saying that activity associates or correlates with better outcomes, whether that's cancer-specific survival or overall survival. So we don't have those randomized studies, but what we do have is studies showing that it can improve things like body composition. So it can improve muscle mass, bone density, decrease adipose tissue. And we know those factors correlate strongly with cancer-specific outcomes and overall survival.
And now, are you doing a combination nutrition and exercise in these programs?
So on study, the intervention's purely exercise, but what we're seeing is when patients come in, we hook them with the exercise, and then we hit them with some nutritional recommendations as well. So it's a good way to hit them with both ends of the spectrum.
And now, when we talk exercise, there's obviously so many different types of exercise, right? It used to be, it was all about cardio. Then it was sort of all about interval training. Now it's all about resistance training, and it's sort of like a multi-leg stool. What do you see as the priorities for what type of exercise to get people involved in first for cancer prevention and treatment?
Definitely resistance training. So we want to improve body composition. That's where we're seeing the strongest signals in terms of outcomes. There's really only one way to increase muscle mass, and that's through resistance training. The nice thing is these are intense regimens. It's functional compound movements. So it gets very intense in the meantime. So you're getting aerobic training there as well, right? Their heart rate's through the roof, but you're seeing those big benefits from resistance training. And then again, improving function, right? Being able to squat, deadlift, those kind of movements, that's going to stop a patient from falling, breaking a hip, especially someone who's on anti-estrogen or other chemotherapy or treatments that weaken their bones. So that's the priority in terms of exercise.
Yeah, actually, that's such a good point. That, I mean, as you're going through cancer therapy, your body undergoes so many changes. And unfortunately, one of those changes could be weakness, sarcopenia, decreased functional ability. So to have them exercising to preempt that is so important. But now, you said intense. So I'd imagine for a lot of people who haven't really focused on exercise, haven't trained very much, they might hear intense and be like, whoa, that's not for me. I can't do that. So how do you handle some of the beginners to bring them in?
Sure. When I say intense, it's a good point. It is a misnomer. In the weight training world, when we say intense, we mean heavier weights, heavier lifts, not the getting your heart rate up to 300 or anything like that. What I tell everyone is the first 2 weeks are a big 2 weeks, right? It's a total mindset, total change in thought process. What we do is we get the movements down, and then once the movements are down and we're safe, then we start adding some weights on. So the first 2 weeks are definitely a tough time for everyone. Then after that, they're hooked. And everyone's hooked. We have 88-year-olds deadlifting.
That's amazing. Oh, that's fantastic. Now, I'd imagine if somebody is going through their own cancer journey and they're seeing their local oncologist and they say, hey, I want to start an exercise program to help me, they're probably going to get like a blank stare back, I'd imagine. So how do you, I don't know, what's your message to people to how to get started, or how do people find you, or how do they find information to maybe bring to their clinician to say, look, this is important and something I want to do?
Yeah, great question. So we need to quantify what we're prescribing here, right? We say if you're going to get radiation, you get a specific dose, right? If you're going to get chemotherapy, you get a specific dose. If you ask for exercise, they say, yeah, go exercise, right? And then you enter this black box. So we view it no different than the general population, right? If you wanted to improve, you go see a sports performance specialist, you make sure you're safe to exercise, and they give you specific exercises to reach the goals you're trying to reach. So for our goals, we want to put on muscle mass. So we do regimens that increase hypertrophy. We want to increase bone mineral density. So we do regimens that load the bones, that load the joints. And then we want to improve functional mobility. And this is why we don't do a lot of machines. We do compound functional movements. So these are the type of things patients should look for when they're seeking out guidance on what exercise regimens to do. And good certified strength and conditioning specialists are something we want patients to see, because again, we want this to be quantified and we want goals to be met.
Yeah, such a good point, that for a prescription for a drug, it's very specific, but for exercise, it's go exercise more.
Yep.
And improve your diet too.
Yep, exactly.
Exactly.
Yeah, diet's the same. Diet's exactly the same, right? We need to be very specific in our prescriptions.
And so how does your dietary prescription usually look? I mean, if it's about improving body composition and lean muscle mass, does protein play a central role, and what's the role of carbs? Like, how do you look at that?
Yeah, I mean, we're generally on the lowish carb side. Don't necessarily have everyone do a ketogenic diet or anything like that. Some people certainly do, but carbs, as we all know, are the number one enemy for most of these people in terms of trying to get fat loss going. So that's the first thing we go through: have them eating real foods, cooking their foods, changing the mindset. Then, of course, as you mentioned, protein. These individuals are undergoing resistance training, so we do need to get the protein up. So we try to match some levels there. And then, it's a captive audience. The whole time during the workout, we're saying, what'd you have for breakfast today? What'd you eat last night? We're just kind of pounding the message home.
Yeah, I remember when I was a cardiology fellow, I'm in a preventive fellowship program. Part of my job was just walking around the track with the patients. And it was just the perfect opportunity to ask them about their life, what's going on, about how they're feeling, and sort of like do the outpatient visit walking around the track. And it seemed so much more impactful. So I imagine it's the same when you have them in the gym working out.
Oh, for sure. And the nice thing is, when we're warming them up, if they had cereal for breakfast, then they know that they're going to get a much harder workout. So they kind of get scared of me. So it's a good way to improve some dietary habits.
A little positive feedback for the dietary habits. Great. Well, I really look forward to hearing your talk later today. And thank you so much for joining us.
Thanks for having me. I appreciate it.
All right. Dr. Colin Champ, thank you for joining us. And we'll be back with more interviews here at MHS.